morning, everyone. We have a topic of hypothyroidism and the role Ayurveda can play in the healing process. Presenting this topic, we have Dr. Sunil Vashist, who is MD in Ayurvedic Medicine and PhD in Ayurveda Cardiologist. He is one of the top Ayurveda doctor from India who has done joint work with his wife for the last 40 plus years. The duo has been setting the trends in scientific Ayurveda practice for more than 3 decades. Based on their clinical experience, they have been in Ayurveda pharmaceutical industry for the last 12 years or so. We are honored to have top Ayurvedic physicians with us who will talk about thyroid and how Ayurvedic medicines and herbs can help. I am Amita from Nourish Talk, a global platform for natural, holistic, and integrative therapies. I am super excited to introduce all of you to Dr. Sunil Vashist, who is joining us live from India. Namaste and welcome. Dr. Vashist, you can start if you like.
Namaskar to everyone, all the participants. So as the topic is very clear, I'll be speaking on the menace of hypothyroidism. And most of us know that this is a huge problem in this era. So as the statistics tell us that across the world, now the data says that in different areas of the world, from 0.2% to 5.3% of the population suffers from hypothyroidism. But the condition in India is very bad, where every 10th person, I mean about 10% of the population, they have hypothyroidism. So it's a huge problem. Next, please. Next, yeah. Now, to start with, I will just try to give you a look of thyroid system, how it works. Thyroid gland is there. It is in the neck, in the front of the neck, near the throat, and it secretes a very, very important hormone that we call thyroxine. And but this is not independently secreted. It is under the control of another endocrine gland which is there in the brain, anterior pituitary, and the anterior pituitary gland is under the control of hypothalamus. So it's a very intricate system. But this hormone, thyroxine, is required for metabolism. That's very important. Metabolism. So every cell of the body, it gets affected if there is slightest fluctuation in the secretion or formation or functions of thyroxine. And whenever there is some obstruction, some inhibition, some decrease in thyroid functions, we call it hypothyroidism. Next, please. Now the question is, what causes hypothyroidism? What are the important causes? So primarily there are 5 or 6 main causes. The first one, even today, in this era of iodized salts, when people are taking, out of say we have 745 crore people across the world, and out of those 100 crore people across the world still have iodine deficiency. See, iodine deficiency even today is a very significant cause. And then ironically, the second most important cause is excessive intake of iodine. So on the one hand, we have patients who do not get adequate or enough iodine, and on the other, particularly the elite class, the well-to-do people, they take excessive iodine, and it affects in a wide variety of ways. Out of this, there is one negative feedback mechanism. The other one is there may be some reaction in the body to excessive iodine, and it may result in hypothyroidism. That means underactive thyroid. The third factor that results in hypothyroidism is toxins and radiations. See, we are living in an era where there is too much of pollution. And this environmental pollution is because of some toxins and poisons. And some of those toxins are even man-made. So these toxins and poisons and then radiations, they damage the thyroid, and ultimately the result is thyroxine is not secreted in enough quantities. And fourth, again, very important cause is autoantibodies. This is what we call autoimmunity. Antibodies, they are produced for the thyroid cells. So what happens? Body's own immune system attacks the thyroid gland, and the result is thyroxine is not produced in the optimal quantity. Then fifth cause is there may be some problem in the hypothalamus and pituitary, and then there could be some more, so there could be some diseases, there could be some more factors, but these five are the most important causes. Next one. Now, so far as the pathogenesis of hypothyroidism is concerned, we have primarily four types of abnormalities. One, the activity of thyroid gland, it decreases. There is low activity of thyroid. That is why hypothyroidism is called underactive thyroid. Now, the second abnormality that happens is because of autoimmunity, and there is inflammation in the thyroid. It is a chronic inflammation, long standing, it damages the thyroid cells, and ultimately the result may be that the overall production and secretion of thyroxine comes to very low levels where the body may not be able to cope up with its own demands. Then third abnormality that takes place, as I discussed earlier, is accumulation of toxins in the body. And the fourth one is iodine deficiency, as we discussed. So these are the four types of basic abnormalities. These are very important because ultimately the management has to be directed on these abnormalities. And on the when it happens, when the thyroxine is not in enough quantities, so many complications, so many problems, they develop inside the body. There could be dyslipidemia, there may be lipid peroxidation, there could be depletion of antioxidants, low-grade inflammation in various parts of the body, autoimmunity could be there. So, because as I discussed earlier, because thyroxine is needed by every cell of the body, whenever there is some defect in the thyroxine, in its production or in its functioning, every cell of the body gets affected, and obviously the consequences sometimes they are very bad. Next slide. Now, so far as the effects of hypothyroidism are concerned, what happens to the person or the patient? So from head to toe, and from skin to the deepest cells of the body, there are so many symptoms, so many signs that can develop. The patient may have tiredness, malaise, weight gain, anorexia, cold intolerance, poor memory, changes in appearance, depression is there, poor libido, goiter could be there, puffy eyes, dry, unambiguous hair, dry coarse skin, arthralgia, myalgia, muscle weakness, constipation, so many symptoms are there. Then when it comes to signs, there may be mental slowness, the dry thin hair may be there could be hypertension, hypothermia, heart failure, bradycardia, pericardial effusion, so many signs are also there. This wide plethora of symptoms and signs tells us that hypothyroidism is a huge problem. It affects almost every system of the body, and we need to take very serious note of it. We need to come out with some effective, medicines or effective management for this. Next, please. Now, what are the investigations that are done for hypothyroidism? Obviously, we go for TSH and it is usually raised, and then we go for T3 and T4. It could be normal, and then we call this is subclinical hypothyroidism. And then T3, T4 could be low, and it is overt hypothyroidism. If there is autoimmunity, obviously anti-TPO in the blood are raised, then there could be some autoantibodies in the blood against the thyroid cells. So, these are the usual investigations that we send for. Then there are some uncommon investigations, and raised creatine kinase could be there, liver enzymes are raised in the blood, cholesterol, is raised. It's a complication also. Ultimately, it results in atherosclerosis and obviously heart disease, brain disease, and so many other complications. So LDL cholesterol could be raised, lipoprotein A is raised. Sometimes sodium is lowered in the blood. Antidiuretic hormone could be raised, and then diagnostic imaging is also done for thyroid. These are the tests, these are the investigations that are done in case for diagnosing this hypothyroidism. Next, please. Now the most important question is how we treat, how we manage hypothyroidism as per principles of Ayurveda. Now, if I go with the jargon of Ayurveda, it may not be understandable for everyone. So I'll try to make these things very simple so that everybody understands. So grossly, what we can do is we can, classify the management in 4 parts. Number one, we need drugs that are thyroid-stimulant. We need drugs that stimulate the underactive thyroid. This is the key point. This is the key approach for the management of hypothyroidism. Without this first management, we cannot proceed. Secondly, if the hypothyroidism is because of autoimmune process, and then the disease is called Hashimoto's thyroiditis or autoimmune thyroiditis. In such cases, we need some immunomodulator drugs. In Ayurveda, there are so many medicines, so many groups of medicines rather, that have been, researched for the last many, many years. And we know we have a long list of medicines that we call immunomodulator medicines. So this is the second group that we need to, use in the management of hypothyroidism. The third group is antitoxic drugs. As I discussed at the very outset, in the body, there are some toxins and poisons, they get entry from outside and they damage the thyroid gland. And unless we detoxify the body, unless the body gets rid of those toxins and poisons, we may not think of managing the hypothyroidism or underactive thyroid properly. So we need some medicines that are antitoxic. And the fourth one is, if the patient is having iodine deficiency, obviously we need to advise and use foods and supplements for replenishing the deficient iodine in the body. So these are the 4 groups of medicines and non drug measures that we need to use for managing hypothyroidism. Next, please. Now let us start with because we are Ayurveda physicians. So we have been working on medicines for many, many decades, several decades rather. So I would be naming some of the medicines that have been described in Ayurveda for the management of conditions that quite a lot mimic hypothyroidism. Because hypothyroidism as such, we cannot find this name in Ayurveda, but there are disease conditions that are quite like hypothyroidism, and for those, with the management of those diseases, there are so many medicines described. And it's not possible to enumerate all those medicines, but the ones that we found effective, and even scientific research today says that these are effective medicines that I will be discussing. So far as the thyroid-stimulant drugs are concerned, the most important drug till date is Guglu, which is Comifuramocul, then Brahmi. It's a methyl, that means it is a nootropic medicine. It works on brain, but at the same time, now research tells us that this Bacopa monnieri is a very effective thyroid stimulant. Then we have pippali, piper longum. It's a black pepper sort of thing. Then one medicine is there, gandir, and its botanical name is Coleus forscoli. Again, widely researched, and it is an established thyroid stimulant drug. Now, one more important, medicine, and we use it in our kitchen also. That is rakta marich, capsicum onion, red pepper. It's, it is sometimes some people, they wonder whether red chili could be of some medicinal value. So I would say yes, this is an effective thyroid stimulant medicine. Uh, the reason why this was not included in Ayurveda texts, ancient Ayurveda texts written thousands of years, the reason is this is not an Indian, this plant is not of Indian origin. It came from Latin America, Mexico and Chile. That is why it is called chili. And but it is very effective thyroid stimulant medicine. So it needs to be used in our cuisine also. Then another medicine is chitra, plumbago zelanica, quite effective. Bhallatak, Semacarpus anacardium, shunthi, gingiber officinale, and vidang, Amelia rives. So if we are having Ayurveda doctors in this audience, they might be appreciating that these are quite effective thyroid stimulant drugs. And what we did was, out of this, we selected some few, say Guglu, Brahmi, Pippali, Gandir, and Rakta Marich, and we came out with the medicine that we have, thyrin tablet. It is available. Next, please. Now, so far as immunomodulatory drugs are concerned, as I discussed earlier, because autoimmunity is a very, very important cause today, especially in women. And then again, usually, this is our observation that people who use too much of iodine, iodized salts, they are quite prone to develop this thing. And Hashimoto's thyroiditis, as I told you earlier, that is the disease condition. Now, in such conditions, what we need some immunomodulatory drugs, medicines that modulate the immunity. So, what happens in autoimmunity is body's own defense cells, B lymphocytes and T lymphocytes, they start attacking body's own cells. But in this case, mostly these cells, lymphocytes, B lymphocytes and T lymphocytes, they attack thyroid cells. And obviously, in the initial phase, inflammation of thyroid cells, that takes place. Ultimately, the damage, proceeds, and ultimately there could be death of the thyroid cells. So in such cases, we need immunomodulatory drugs. And in Ayurveda, such drugs are called Rasayana drugs. We have a long list of Rasayana drugs or Ojah Vardhak drugs. Out of those, the most important three drugs are Bhallatak, Uglu, and Chitra. And out of this, we have these three, we have made one Replac tablet. But there are so many other Rasayana drugs, immunomodulated drugs, and the most important, widely known, is Ashwagandha. Then there is Tulasi, Guduchi, then Piper, again this Pippali, and Yashat, again very, very important medicines, members of immunomodulatory drugs. Then there are some more medicines, even gold, Swarna Bhasma, that has been claimed to have immunomodulatory action. So this group is particularly useful in patients who do not respond to the first group of drugs. Some patients come to us, they come with hypothyroidism, and if we do not investigate the patient fully, and if we are not really aware that this patient is having some autoimmune process, if we go on treating with the patient with the first group of medicines, the patient may not respond satisfactorily. And in that case, if we go for anti-TPO, we find that the patient is having autoimmune thyroiditis. In such cases, addition of these immunomodulatory drugs is really quite useful, beneficial, and we can see the results. Thank you. And next, please. Now, as I told you, there are some more, important immunomodulatory drugs: ashwagandha, tulsi, guduchi, pippali, and yashad. These are again quite important and very effective. And we have come up with a preparation called Immuni tablet. Again, a very effective immunomodulator medicine, widely used for other conditions, disease conditions also. I mean, autoimmune disorders, and particularly in hypothyroidism. Next, please. Now, again, as I told you, toxins, they either get access into the body from outside, from the environment. They could be inhaled, or they could, enter the body through our food or drinks. But sometimes they get access through the skin also. So once they enter into the body, they damage various cells of the body. Now, for some unknown reasons, some toxins have special affinity for particular organs. So there are some chemicals, some pesticides, some other, man-made, some pollutants are there, chemicals are there in the environment. They have special affinity for thyroid cells. So what happens is, sometimes we do not find any other reason. So maybe the person was exposed to, these toxic substances, entering the body from outside, or sometimes the toxins could, they get produced within the body. And Ayurveda calls these toxins as amavish or am. So it's very important that we detoxify the body. We detoxify, we somehow, we detoxify these toxins and poisons, so that the body gets rid of this. And for that, we have so many medicines, but particularly the medicines that are effective on liver disorders, they're quite effective. And the top on this list is Bhumi Amalki, Phyllanthus neruri, very, very commonly known. We have phylosil tablet out of it. Then Kakamachi is there, Solanum nigrum, Katuki is there, Picorrhiza curo, Unanava, Boravia diffusa, Haridra is there, Terminalia cebula, Bringraj, Eclipta alba, Haridra, Curcuma longa, and Bhallatak, Semicarpus anacardium. You might be noticing that there is some repetition in some medicines. They could be effective in one group, then in the other one, and even in the three groups. So these are, indicative that one drug is quite effective in hypothyroidism through multiple modes of actions. So this is a group particularly effective on liver disorders. They improve the liver functions, but at the same time, they detoxify the toxins and poisons and help in the management of hypothyroidism. Now, next please. Now, if the patient is having iodine deficiency, obviously we need to replenish the deficient iodine. And in that case, we have some medicines, then some other, food items, and Jalakumbhi. Jalakumbhi is one medicine which is used even as vegetable also. Then Kanchanar is also there, Oinia variegata. Its flowers are used as vegetable. It is quite useful. Kanchanar Gugli is one product that is widely used in hypothyroidism. Then we have iodized salt. Saintham salt is there, rock salt. It has quite a bit of, iodine in it. And potatoes. See, we need only 150 microgram of iodine in a day, in any single day. So that means 1 milligram has 1000 micrograms. And what we need is 150 micrograms, not even 1 milligram of iodine is needed by the body, And that deficiency could be replenished or supplemented even if somebody takes simply 2 potatoes in a day in 24 hours. So one potato has about 70 to 80 micrograms of iodine, medium-sized potato. Similarly, we can have milk and curds. 1 cup of milk or curd has about 50 to 60 micrograms of iodine. So again, this could be used, and deficiency of iodine could be uh, you know managed with this. Then we have eggs and fish. Again, it contains iodine, and there are many sea vegetables. Sea vegetables, they are rich in iodine. So these are the foods or some medicines like Jalakumbi and Kanchnar. They are rich in iodine, and these are recommended for the management of hypothyroidism, and again quite effective. Next. So now again we have summarized, all the principles in one slide. We have thyroid-stimulant drugs, we have immunomodulator drugs, we have antitoxic drugs, and then we have supplements for iodine. Next, please. So thank you very much. I tried to make it as simple. I did not use much of jargon. And if there are any questions, kindly do ask me. I will try to answer.
So we are open for questions from people who have joined in Zoom. We have written our email, we've written our website. So you're welcome to ask questions from Dr. Vashist. He is one of the pioneers in based on science-based Ayurveda and has been manufacturing medicines for the last 20 plus years or maybe more. So you're welcome to ask him any questions. I can stop sharing and if people have any questions. And any comments, any feedback, you're welcome to ask Dr. Vashist. So one of the things, I have a question. You talked about some of the components, you described okay, so I see a question coming up. I'll ask my question later. I'll stop share. I'm stopping the share, so you're welcome to ask questions confidential. It won't be, your questions seen. Okay. So the question is, where can I buy these drugs in Canada? Right now, I think they're only available in India for now. Yeah. We can let you know. We will be working with Dr. Vashist, and we can let you know if when they're available in Canada. But if you have any other questions, they've done a lot of science and research that's gone behind, so any other questions you have? Okay. So the question is, what people cannot eat when they have hypothyroidism? You said what to eat, but what is it that people cannot eat?
It's a very controversial thing to tell, but the only thing that has been, incriminated or blamed is cabbage. Certain, cauliflower is sometimes, it is prohibited. There could be some more things, but usually cabbage is prohibited. But again, we need to have enough data before we ask the patient not to take this. So it's good that we don't take things that aggravate the condition, but we must have enough, supporting data, which is not there till date.
So, and also sauerkraut, I think sauerkraut, right?
Yeah.
Those can you take them or you cannot take them?
Which one?
I think it's sauerkraut. No.
Okay. There is a list of eatables that people that many doctors that prohibited, but usually there is no backing data. So that is why I avoid such things.
Got it. So you think anything related to sauerkraut is the one. That's also raw cabbage. I'm just checking online right now. So that's also finely cut raw cabbage, and that also, can you take them or not? But it's fermented. Can you take sauerkraut? Is what they call it. Sauerkraut. It's like a fermented cabbage. Can you take them or not?
Okay. I'm not sure. I don't know much about it. Yeah.
Okay. All right. So there's a question coming up. He is saying, someone is saying their son with 20 years of age has hypothyroidism. TSH is 30, weight is 95 kilos, and takes Eltroxin 100 milligram. So what is the question you're asking? I think it's Eltroxin is a general conventional medication. That's what I'm assuming. So you wanted to switch to Ayurveda? Is that the question? I just want to clarify the question because from what I can understand that you have a son who's 24 years old who has a hypothyroidism and is taking Eltroxin 100 milligram. So the question is that do you want to understand what the Ayurveda medication is so can you clarify please? Okay, then someone is asking, we use, yes, they're asking if they're taking Eltroxin 100 milligrams, is it possible for them to switch to Ayurvedic medication or not?
This is a very important question, and many people ask about it.
Yeah.
What we have observed over the years is,
yeah.
if the patient is a fresh case of hypothyroidism, that means he or she has not used any this thyroxine or Eltroxin. So it's very not very easy, but it is easier to manage such cases with Ayurveda medicines. But once they start taking Eltroxin, it becomes tough. So usually it takes 3 times more time to manage these patients with Ayurveda medicines, because the mode of action, what Eltroxin is, what the thyroxin being given from outside is, it is simply a supplementation. We are giving something which is not being produced in the body. So it affects the body adversely. See how? When the body system knows that enough of thyroxin is there, so obviously the inner, the manufacturing or production system in the thyroid, that will be shut down. Shutting down of the inner system is something very unfortunate. So what we try to do is, we try to stimulate the body's own system of producing thyroxine. So what we do in such cases is, we start our treatment, whatever we have discussed, whatever is actually required for the patient, we start these medicines along with the Eltroxin, and over a period of time, if there is improvement, which is there in many patients, the doctors, the prescribing doctors of Eltroxin, they go on decreasing or lowering the dose of Eltroxin. We don't do it. The patients should do it themselves. So this is what we do, but it is possible in many patients. And obviously, if their son is suffering from this disease and is taking 100 microgram of Eltroxin, obviously they need some very close supervision and treatment for it. Maybe improvement could take place.
Okay. Hope that answered your question. Any feedback or any comment on your question you want to add, please? Okay. All right. So now someone is asking, I think this is a doctor who's commenting, we use Hamsa Patradi Kashyam and Kanchanara Google tablet for hypothyroidism. What is your view on this?
Yes. Kanchnar Google, as I discussed in the last part of my presentation. Kanchnar, it supplements iodine to some extent, and it has some immunomodulatory action also. And Guglu, as I discussed at the very outset, again, this is thyroid-stimulant. A lot of research has gone on it, that this Guglu is a thyroid-stimulant. So obviously, Kanchnar Guglu is effective. But the problem with this is, doctor, we do not use Kanchnar Guglu in enough dosage. It should be ideally, as it has been described in Ayurveda texts, it should be used in 1 to 3 grams, in a single dose, which is usually not used. That is why many times we don't get satisfactory results with it. So if you use it in enough quantity, enough dosage as prescribed in Ayurveda texts, obviously you will be getting results. The second medicine is quite common in South India. Obviously, that is also effective, but alone it may not be. It needs some supportive medicines.
Okay. So the person who asked earlier, whose son is suffering from hypothyroidism, is asking that how much time will it take for him, for his son, This is not a medical advice, it's educational sessions. I just want to point it out. We have Dr. Vashist educating us, but I don't know. If it's up to you, Dr. Vashist, if you'd like to answer. And then he's asking about which Ayurvedic medicine will you prescribe for him? Like I told you, this is not a medical advice, please. These are educational session. Right. And,
See,
Dr.
it's
add
very
something.
difficult. It is very difficult to predict how much time the patient is going to take, or whether he will be really, able to quit, or the doctors would be able to stop thyroxine altogether. Because once the body gets habitual of thyroxine from outside, sometimes its requirement is always there. But
Yeah.
in many patients we have observed that we are able to stop it, but time could be anywhere between 1 year to 3 years, or even 5 years. It takes a lot of time.
A long time.
The
Oh
body
my
to adjust. So any guesses may prove wrong.
Yeah. Well, think of it as a positive educational session today, and you can start on that process. That's right. And Dr. Vashist, you at least start on the process. That's all I can say. Okay, moving on. Someone is asking if any patient is suffering from hypothyroidism and he or she is not taking any medicines, what are the complications in this case?
Oh my God, so many complications, so many complications.
Okay.
Every cell of the body could be affected, because actually, what this thyroxine does is, it helps in the metabolism. Metabolism is whatever food, nutrients we take, they get, broken down within the cells. And for that, thyroxine is required. If it doesn't happen, then obviously weakness has to be there. Manufacturing processes in the wherever there is some manufacturing taking place, particularly the proteins, that comes down. The body's defenses, they become very low. Osteoporosis could take place, brittle bones. This atherosclerosis can, this cholesterol can, rise, low density lipoprotein cholesterol, it can rise. Then HDL, good cholesterol comes down. Triglycerides, they rise. Even diabetes can take place. Obesity is there. And then in females, periods, there may be problems in the periods. And obviously, infertility could be there. What not, hypertension could be there. So many things, there's a long list of diseases or complications that can happen.
So it's very important to seek help. And
thyroid should be fine. We must be fully aware of thyroid health, and irrespective whether you use any medicines, whether you use Ayurveda medicines or allopathic, but your thyroid should be normal. You must get proper amount of thyroxine from within or outside, so that you stay healthy. That's important.
Okay. Any other feedback on question on this? Are you a person who asked this question? Okay. All right. You can still comment. We have time. We have 1 hour, so total 1 hour. Okay. Someone is asking, is hypothyroidism reversible?
Yes and no, both.
Okay.
Yeah. When it happens because of iodine deficiency, then it is reversible. But if the problem is a deeper one, for example, if the person is suffering from autoimmune process, there is a autoimmune thyroiditis or Hashimoto's thyroiditis, as I told you, then obviously the person has got to take the medicines across their lifetimes. So it may not be fully reversible, but usually what we have seen is, not making claims, but sharing my experiences, especially with the Ayurveda doctors. I want to tell them that, could I speak something in Sanskrit?
Oh, yes, please. And please translate it in English after that, because a lot of people don't. Yes, please go ahead.
Ayurveda doctors know what I'm talking about.
Okay.
Ayurveda says, it's a something very surprising, amazing for every one of us. 2000 years ago, some Ayurveda, Acharya, he gave a statement that, in my view, is the biggest statement ever given in medical history. That Acharya said, all the diseases, they happen because of low metabolism. And in Sanskrit, he told, Rogaha sarve api mandayagnam. That means all the diseases, they develop because of low metabolism. And metabolism is directly related with thyroid. So in that case, uh, thyroid, functioning of thyroid is very important. This is key for the health of the individual. And one needs to, do everything that he or she can do. But thyroid needs to be kept normal. And could you please tell me the question again? I'm forgetting.
They were asking whether it is reversible or not.
Yeah, yeah. So it is reversible. It is reversible. It is all the reversible diseases in Ayurveda are called sadhya. In some patients, if it is new, if the underlying disease process is not very severe, it is not very deep, it is curable, then of course in such conditions we can reverse it. But usually what we see is when we give intensive therapy, I mentioned something about the dose. It is more related with the Ayurveda doctors. They will understand it. Underdosing is the major cause for Ayurveda medicines not to be effective. So what we did was we used, whether we used one medicine or two medicines or three, well, what we used in therapeutically effective doses. So if we use these medicines, whether they are single or in combinations, or and combinations could be classical as written in Ayurveda texts, or they could be experience based as we have come up. So any medicine needs to be given in therapeutically effective dose. Results are really sometimes very encouraging. This is for Ayurveda doctors. They're very encouraging results.
So follow-up question is, in Ayurveda, in addition to the medication, there's like panchkarma therapies, right? So do you think if someone gets on an Ayurvedic medicine, like all the things that you talked about, the gugulu and other things, but they should also go for some panchkarma therapies at the same time, and also take care of course, the yoga and the diet you talked about. But I'm just particularly interested to find out if the panchkarma therapies also help in hypothyroidism.
Again, very nice question. Yeah, I skipped it for some reasons.
Okay. Okay.
I did not want to sound too technical.
I see.
Yeah.
No, it's okay. We can be a little bit more technical.
Okay. Panchkarma is primarily used for detoxification and purification.
Mhm.
So whatever toxins and poisons they get accumulated inside the body, they build up in the body. So it's a very scientific way of first detaching those toxins from wherever they are sticking, wherever they are there. Detach those toxins and poisons, bring them into circulation, bring them to
I, I think there's some network issue. We can't hear Dr. Vashist right now. I, there seems to be a network issue somehow. Yeah, can you hear me? And, well, I think, I don't know what happened here. Okay, he is joining us again. I think if Dr. Vashist Dr. Vashist, are you able to join us or are you able to talk?
Yeah,
Okay. Okay. There was some, I think we were talking about the Panchkarma. So.
Panchkarma. So whatever, is toxins and poisons are there inside the body, whether they have come from outside or they have been produced in the metabolism from within the body, they are to be detoxified first and then they need to be expelled out through either emesis, I mean vomiting, or purgation, that means through loose motions and like that. So it's a very technical thing, quite effective, but not in all the patients.
Okay.
Yeah, not in all the patients suffering from hyperthyroidism. Patients who particularly have autoimmune disorders, there the Panchkarma is quite effective.
Okay. Okay. Any more questions? Any comments? Any feedback before we sign up? Before we sign out, sorry. Okay, I see one more question coming up. Okay, so someone is asking, what will be the heavy metal content in the products you mentioned in your presentation?
See, most of these products, they don't have heavy metals, or even if they have, they are within normal range. So we don't use products where heavy metals are out of the normal range. Okay. But sometimes, what happens, they're not actually, these are the herbs, but sometimes, heavy metals gain access from the soil itself where they are grown. So soil has heavy metals. We don't add up heavy metals to the medicines, but they
Okay.
come from the soil. That is the reason. It's a big problem we keep on facing, but usually we don't use medicines that have heavy metals.
So these are all herbal formulations.
About 99% of these are herbal medicines.
Okay, all right. Any other comment, any other question before we wrap up? I think it's an excellent session, so much engagement, a lot of people asking a lot of questions. That's really good.
Okay.
Any final comments or feedback from the audience? Okay, thank you. You're welcome. All right. I see one more question. Is it certified? Certified meaning? What do you mean by is it certified? Doctor, I think it's probably a doctor.
Yeah.
When you mean by certified, they're selling, they've been selling their medication in India for the last 20 plus years. So definitely it's certified.
These are approved medicines that are registered.
Yeah, these are all approved.
Yeah.
Yeah.
Approved by FDCA.
Oh, okay. Okay. Oh, he means by heavy metal content. So heavy, you said that you don't use that heavy metal content.
We have laboratory reports.
Yes.
That tell us that these don't have heavy metals in excessive amounts.
Yeah. I hope that answered your question. Okay. All right. Any final comments? Anything else? I'm just going to wrap up. I just don't want to leave any other questions if you have anything. Okay. All right. Is that okay? Okay. All right. Thank you so much, everyone. And thank you so much, Dr. Vashist, for joining us and giving us this educational session.
Thank you,
yeah.
And thank you, everyone, for sparing your time to listen to me. So nice of you. Thank you very much. All the best. And namaste.
Thank you. Thank you so much. Namaste. And everyone, thank you so much for tuning in to our sessions. Please share our sessions and let us know your feedback. Thank you so much. Have a great weekend. Thank you.